Helen, welcome. It's been a little over 6 months since the world came to the knowledge of an outbreak of the Ebola virus disease in Guinea. This outbreak has since evolved into the largest, most severe and most complex in the history of the disease. The three most affected countries, Guinea, Liberia and Sierra Leone, still face enormous challenges in stopping transmission and providing care for all patients. Nigeria has had its own share of the Ebola virus, but thankfully the situation is under control. Now the question is, how did Nigeria get around curtailing the virus from going on rampage in the country? I'll be having a conversation with a country director of the U.S. Center for Disease Control, Nancy Knight, and we'll be reflecting on the Ebola incident in Nigeria and also on moving forward. Once again, welcome to Health News. I am Yomi Otaigbe. The World Health Organization, UNICEF, and the U.S. Center for Disease Control are among the international partners that worked with health authorities in Nigeria in the containment of the Ebola virus, which was imported into the country by the late Liberian-American Patrick Sawyer. As it stands, the total number of confirmed EVD cases recorded in Nigeria remains 19, with 12 survivors and sadly 7 deaths. Among her West African neighbors battling the Ebola virus, Nigeria has been commended for her efforts. On what made the difference, here's the country director of the U.S. Center for Disease Control in South Africa, who came on a backup mission in Nigeria, Nancy Knight. She talks about the CDC efforts in Africa and her assessment of the Ebola situation.
The CDC's role in the Ebola outbreak, this Ebola epidemic, is not just here in Nigeria, but across all of the affected countries, as well as some of the neighboring countries. CDC has been part of the international partners that have come in and started working with those host country governments on their response. We have helped with the epidemiology of the disease, so that essentially means with identifying where the outbreak is occurring, how it's being transmitted from one person to another person, and helping to contain it. We've also been involved in some of the other countries in providing laboratory expertise as well. We are working with port health authorities here as well as in other countries to help with containment and to prevent the spread from country to country as well.
How do you do containment?
In terms of containment, maybe I'll take a step back and start with the three areas that are really critical in any outbreak response. You have to be able to prevent, detect, and respond. So prevention can come, of course, before an outbreak occurs, and is also something that we do to help after an outbreak has been completed, to help prevent it from coming back again. Detection is where we're identifying what the disease is and what are the appropriate measures in order to contain it. And the response is really that containment effort. So in terms of the response or the containment, the various aspects that have been employed cut across multiple sectors. One is epidemiology and surveillance. So through the epidemiology and surveillance efforts, we identify not only the index case, the person who brought the disease in, but we also identify any of the contacts of that person. It's very critical to identify the contacts and to be able to follow them with Ebola for 21 days on a daily basis. So that's a key piece of the response efforts. If we're not doing that, then there's a chance that someone else who has been exposed could develop symptoms, could suffer from Ebola virus disease themselves, and then continue to spread it to their own contacts as well. So that has been a critical piece both here in Nigeria, but just more broadly when you do have infectious disease outbreaks. So case management is another critical aspect of the response. With case management, that includes the diagnosis, so the laboratory testing that's necessary to determine if someone who has symptoms that are concerning for Ebola truly has Ebola or not. We know diarrhea, vomiting, fever are very common in other illnesses. So we have to tease that out. We can't assume that anyone with those symptoms has Ebola. We have to test them to be sure. While that testing is taking place, those individuals are in our suspect ward of the treatment facility until we have the diagnosis from the laboratory testing. For someone who does have Ebola, they are moved into the treatment ward where they receive the treatment for their symptoms. We know that treating individuals' symptoms, particularly giving fluids, can help to prevent the death of those individuals. People who come in early and who are diagnosed early and who begin to get the symptomatic treatment do much better than individuals who do not. We do not have a specific cure for Ebola, but that doesn't mean that people shouldn't come in. They can do much better when they come in and start to get those symptomatic treatments. Other aspects of the response deal with, for example, points of entry. We know that Ebola can be transmitted person to person, and we know that we have an interconnected world. People travel. And so it's very important for countries that have the disease to be screening individuals as they're leaving those countries to ensure that people who are ill and who have had contact with someone with Ebola are not getting on planes or buses and traveling into other parts of the world. It's also important, for example, here in Nigeria, to do the entrance screening. So as passengers come in, checking them, making sure they don't have a fever, making sure they don't have other symptoms or any risk factors such as contact with someone who has had Ebola in another country. Most of the time, those individuals that we investigate don't have Ebola. They haven't had the contact. So that's really a critical piece. Just because someone has fever, vomiting, diarrhea, we know so many other diseases that are present here in Nigeria can cause those symptoms. So if they don't have any contact with someone who has been diagnosed with Ebola, then they're most likely not going to have that disease.